Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in two cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entrepilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
We're gonna now change topics and we're gonna go to the colon. We're gonna discuss the colon. A lot of problems with the colon and a lot of patients complain about the colon, especially those who are a bit older. What is the most common organ or part in the GI that patients complain about? The colon. What is the colon? It's the large intestine. Large intestine move. They have motility. So that's why we can move the feces. But now you have to be very careful. This motility differs from one patient to another. If we lose the motility, especially in a small baby, that's a totally different disease. We have rectum that has no ganglion cells that cannot move. So movement rely on neuron cells, rely on nerve cells that's inside the colon. Once we get older, this movement, these neurons get exhausted. So the motility inside the colon becomes less. And when the motility inside that colon that move the feces towards the rectum so you can stool becomes less, you most likely defecate in more frequent times, meaning constipation. So all people usually we see with constipation. Why? Because the motility of that colon has already decreased secondary to aging. Maybe there is other pathological factors that we'll explore. But you have a patient. I had a patient a couple of weeks ago that came to the clinic with left lower abdominal pain, meaning what? In the left side of the abdomen, but lower abdomen, we have pain. The patient have pain always in the left side lower abdomen, always in the same spot. Years after years, the pain is still there. Nobody knows what's going on. Well, I'm going to tell you. The most common cause for a pain in the left lower quadrant or the left lower abdomen is something called diverticulosis. The name might be difficult, but I'll make it simple for you. We have normally the colon wall. It's a wall that has different layers. Sometimes we have bouching, we have ballooning of this wall. The wall at some point becomes weak. When the wall becomes weak, it bouches out. It make a bouch. So we have the wall going straight, and then at some weak point, it bouches out, and it makes like something like a sac within the wall. So now it's a weak wall that form a bouch. And now what's in the colon? The material in the colon is the feces. So now we have accumulation of feces in that bouch. According to the size of the bouch, according to the size of this balloon, we will have complication. Any balloon, eventually it will get bigger and bigger and bigger. And what is the outcome once a balloon gets too big? It bursts, it ruptures. That is the same thing with diverticulosis. When we have diverticulum, meaning a balloon inside the colon, and especially the most common place will be the left side, left abdominal pain. Those patients, especially a bit older patient, they always complain of the left lower abdominal pain. That is diverticulosis, diverticulitis. We're going to explain the difference between the two. But again, let me not get you confused. We have bouching of that wall of the colon. That bouch can accumulate, feces can accumulate inside. Since the wall is very thick, we have a chance that we rupture some of the vessels. So the patients will see blood in the stools. So we have now left side pain, left lower abdominal pain, and we have a small blood in the stools. That can only be one thing, which is diverticulosis. Blood in the stools with left lower abdominal pain. Most likely it is diverticulosis. So we do not go any further. Now, if the feces accumulate and feces have bacteria, and now we have a wound, so that means we are prone to infection at that site. So that means we have now a case called diverticulitis, meaning we have the balloon that has been injuring a blood vessel. We have accumulation of feces with bacteria. Now we have an infection. How would the patient come? The patient will show fever. So you will have a little bit of fever, a little bit of blood in the stools, and pain in the left lower quadrant. Very much similar to appendicitis. But appendicitis happen where? On the right side. This happen where? In the left side. So if you have left lower quadrant pain, you see a little bit of blood in the stools, and you run a little bit of fever, we know we have a condition called diverticulosis complicated with diverticulitis. Forget about the names. We have a pouch, we have a balloon in the colon that has a bit of complication. Well, number one, bleeding. Number two, possible infection. So now the patient will run exactly the same scenario like appendicitis, So what is the situation here? Well, you cannot go to somebody and tell them, do me an endoscopy, a colonoscopy, whereby I put a colonoscopy there. And the colonoscopy, what we do with the colonoscopy, we put air, we inflate air. So if we have a balloon inside the colon, and then we add air to the colon, what's going to happen to the balloon? It's going to rupture. So that is a problem. So you cannot be doing colonoscopy for a patient suspected with diverticulosis, diverticulitis, because you're going to rupture the balloon, and then we have perforation, and that's a big problem now. So you came with a small problem, we send you home with a much bigger problem. So we do not do colonoscopy for such patient. So what is the recommendation? If we have this case, then we do CT scan, much safer, and we will see the diverticulum or diverticulosis or diverticulitis. We can easily see it with a CT scan. If the patient has the fever and complicated to diverticulitis, then we add a little bit of antibiotics, and the patient goes home and the situation will be resolved. So careful diagnosis and careful approach to a patient with diverticulum, diverticulosis, diverticulitis is essential for the safety of the patient. Number one, we cannot do colonoscopy if the patient proven to have diverticulitis, because the wall is already thin and we can rupture. Best thing to do, CT scan. And after the CT scan we see is safe, we can do a colonoscopy to determine if we want to do something about it. But normally it resolve with a little bit of care. Before we move to another patient, I want to tell you another complication that you may look out for. If you see air bubbles in the urine, when you urinate, you see air bubbles, or you see fecal matters, feces inside the urine, that's a very alarming sign here. So if you have the history starts with pain in the left lower abdomen, always there, pain in the left lower abdomen. Then you see blood in the stools. Then you may develop fever and you be a little bit sick. Then you see air in the urine or fecal matters in the urine. That's the very alarming sign here. What happened here? What happened is that small pouch, that small balloon there, got growing a bit more, till it touches the urinary bladder where you urinate. When you urinate, you have a reservoir there called urinary bladder. So some pieces of this pouch there at the colon touches the urinary bladder, and when it touches the urinary bladder, it forms a communication. So now we have a hole between the colon and the urinary bladder. That is what we call fistula, but don't worry about the term. So we have a hole that is communicating the colon with the urinary bladder. So obviously the colon has air, so you will see air in the urine, and obviously the colon has feces, so you will see feces in the urine. Once we see that, that's a surgical correction right there, because we already have communication between the colon and the urinary bladder. So this is, in summary, you know, what you will feel or what will happen, what is the possibility if you feel left lower abdominal pain, and the complication we said is bouching, can develop into, start with small bleeding in the feces, then develop to fever and a bit more pain, then it can even complicate to seeing air or feces inside the urine. So at the first sign of left lower abdominal pain, you should not ignore it. You should seek help and see a professional doctor to evaluate and correct the problem before it gets much worse. Okay, so now you know, and for all the clinicians out there, anybody with left lower quadrant pain, we do not do colonoscopy because of the fear that you may rupture the pouch if there is one existing there. You cannot do that. You have to start with a CT scan, get a roadmap, and then if you want to do colonoscopy later, you can do that later.